Hi, my name's Carolina, and my presentation is focused on predictors of herbal medicine utilization by Mexican Americans. So, just a quick introduction. What is herbal medicine? It is the study or practice of medicinal and therapeutic use of plants. And it can really be understood as any sort of remedy that comes from a plant. And some of the most popular examples that I know of are star anise, which can be used to treat stomach issues, inflammation, and can lower fevers. And then another example would be hibiscus, which I've seen that is pretty popular, and it can be used to lower cholesterol, promote digestion, and reduce fevers. So I thought it would be really interesting to be able to focus specifically on Mexican Americans when looking at herbal medicine utilization because I know I'm Mexican American and I've noticed that the use of herbal medicine is really common. And I just wanted to kind of get a deeper understanding of why that is and the different factors that contribute to herbal medicine usage. So while doing my literature review on this topic, I noticed that there were a few pretty common predictors in herbal medicine usage, and one of them was education. So higher education levels usually had lower herbal medicine usage, and another one was insurance. So in one article I was looking at, it showed that people with Medicaid coverage usually had higher CAM usages overall, and along with that was higher herbal medicine usage. And then the next one is chronic conditions. So among Mexican Americans, it was pretty common that people with chronic conditions were more likely to also use herbal medicine as treatment. And then last was gender. So in I think all of the articles I looked at, it kind of talked about gender and how females were usually more likely to use herbal medicine. So, what is currently known about this topic? So, from the literature I was able to look at, I noticed that it shows that people use herbal medicine for many different reasons, and some people use it kind of in place of conventional medicine, while others use it in addition to traditional medicine in order to promote wellness. And so most of the literature focuses on CAM in general, so CAM usage among Mexican Americans, but I was able to find a few articles that talk specifically about herbal medicine. And as talked about on the previous slide, some of the most common predictor factors covered were insurance, education, gender, and presence of chronic conditions. And there were some other predictor factors that were talked about in a few of the articles, but overall results were pretty inconclusive. So, some of the things I think would require more research are age as a predictor factor. So, while I was doing my literature review, I noticed that age was talked about in most of the articles, but the results were kind of varying. So, some would show that higher ages did have a higher likelihood of using herbal medicine, but some kind of were inconclusive, and sometimes the results, even though they showed higher usage with higher age, the results wouldn't be statistically significant. So that's why I feel it would be important to look more into age and see. And then the next thing would be socioeconomic status. So it was talked about in, I think, a couple of the articles I looked at, but I just feel like there would need to be a more comprehensive look into it to see any trends between socioeconomic status and herbal medicine usage among Mexican Americans. And then lastly, I thought it would be interesting to look at family practices of herbal medicine usage because I feel like if an individual were to grow up in a household that does use herbal medicine, then they would be far more likely to use it in their adult life. So I just think that would be something interesting to look at. So, just to conclude the presentation, how does this topic relate to the broader sociology of wellness and alternative medicine? So, I think herbal medicine is a pretty common form of CAM that's being used, and it's kind of always been used. People have always used different plants to try and treat or cure illnesses. And I feel it's kind of growing in popularity recently as more people are kind of interested in finding natural remedies as opposed to being treated by the conventional medicine. And I think it's important to look at CAM in general through a sociological perspective because it gives us a better understanding of the sociological influences that contribute to CAM utilization. And so for herbal medicine, I think it would be really important to have more research done because things change as time passes and people's perspectives on CAM or herbal medicine change over time. So that's why it's important to constantly be doing new research as perspectives shift.